Hi, I would like to greet the HPAS community because we are working on one of the most important challenges that is facing healthcare these days, or health services these days. I'm Miklós Szócska, I'm the director of the Health Services Management Training Center, and my journey with data was also influenced that for 4 years I was Minister of State for Health, and I was the one who initiated the joint national e-health platform in Hungary. But that was because I experienced how easy it is to save lives and public money through innovative management of data. And now it is obvious for most of us working in healthcare that there is a digital or data-driven transformation in health. And this means a lot of things. This means that there will be new people in healthcare who are healing with data. And I had to learn to work with these physicists who are developing artificial intelligence or graph analytics models. And they are also committed to save lives. And they understand the ethics and the complexity of the problems that healthcare is facing. And given that in Hungary we have a joint national e-health platform, we also recognize that the digitization and AI or data-driven solutions is not just an IP, a startup, or a license that you buy from an equipment company, but this is a systems capability. Just recently we have completed a joint national pilot on how can we use artificial intelligence in pathology diagnostics. And in that process I have learned how we should talk to the pathologist, how to explain them that their workflow, their traditional work processes will change. And it was also an important challenge. How could I convince them to experiment with the technology, to test its reliability, develop trust in the system? And that experience shows us that this is a complex change, and all those who are involved in it have to experiment, have to develop their own experiences, have to develop their own trust, have to get used to these solutions, because whatever we do, we want to help our patients. And I think digitization, AI, data-driven solutions have a lot of promise that it will give more health to people. And I think we have to take a very long road till we arrive to fulfill this promise, and we also have to be able to avoid all the mistakes and avoid all the shadows and clarify the ethical boundaries for digitization and the utilization of AI in health. So good luck with the project, because we have an important mission. Thank you very much for your attention.